Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, જેમ ગઈકાલે એનાઉન્સ કર્યા હતા, આજે આપણા સમક્ષ ડૉક્ટર ઇકબાલ હૈદર હસન જાફર. ગઈકાલે ભૂલ થઈ ગઈ મારી, હું બોલ્યો ઇકબાલ હસન જાફર ને, હૈદર નામ ભૂલી ગયો. He's grandson of Hassan Jaffer, a very well known person in Mombasa and a very good member of the seniors group. So Alhamdulillah, the topic today is increasing fatigue. It is not just about getting older. So let him give us a talk and explain to us कि जन्नत में बधाई जवान जवाना छे, बुढ़ा कोई नहीं जवाना. એટલે બેટર છે દુનિયામાં પણ જવાન રહીએ તો ત્યાં જાય ત્યારે જવાન જ હોય. સાચી વાત છે ને? ઇન્શાઅલ્લાહ. So without much time, please, doctor.
Assalamu alaikum. Thank you for the opportunity to speak. I mean, I could start in Gujarati, but I will switch very quickly to English because my medical Gujarati is not very good. Just as a brief introduction, I'm a heart surgeon, but I take care of patients on an average age of around 72. So in the North American context, 72 is sort of the average age for heart surgery. The youngest patient I've ever operated on was 1 day old, and the oldest patient I've ever operated on was 98. So we take care of everybody. But the bulk of my practice is adults now. No problem. One of the most common things that we discuss when I meet patients for the first time, and so just so that you understand how patients get to me. Patients have a family doctor, they then get referred to a cardiologist, and then they come to me. So there's a few steps in between. But by the time the patients get to me, they always say, we didn't know how bad this was, whatever their problem is. Now I take care of blocked arteries, I take care of heart valves, I do lots of things. But people always have the similar story when they get to me. And one of the most common findings that everybody shares is, you know, I was getting a bit more tired, but I just thought that was getting older. So that's why I want to really talk about fatigue as a sign of something more. Okay? So, who in the last 6 months, show of hands, has said, you know, I feel a bit more tired than normal, and they have nothing to blame it on. They can't blame it on not sleeping well, they can't blame it on jet lag, they can't blame it on not eating well. Just, you know, I don't know, I just feel tired. Anybody? Two. Everybody, alhamdulillah, as well. That's great. Okay. And? Yes? And? There you go. Perfect. And now you feel great. Perfect. See? So this is exactly the story that I deal with every day. So the finding of fatigue, the finding of tiredness is extremely common. So studies report that between 50 to 85% of people who present with heart disease, their first sign was tiredness, fatigue. Just not quite right. And most of the time they ignore it. It'll go away, I didn't sleep well, I didn't feel well, we all have excuses. The message really is not to frighten you of being tired. We have lots of reasons for being tired. Tired is such a generalized thing. But the message really that I want to deliver is that when something doesn't feel right, it's not just necessarily that you're getting old. Okay? The important things to do are to think critically about how long you've been feeling unwell. Most people have several months of not feeling well before they present to me, but they've been ignoring it for a while. Most people have some additional thing. So if they have blocked arteries, as an example, they have, I have a little bit of indigestion when I go to sleep. I have a little bit of indigestion when I walk. I've noticed that I used to walk the round in 10 minutes. Now it takes me 15. That's very subtle. That's very subtle. But it suggests that you are making minor changes because you don't feel well when you were doing the thing that you were doing normally. Most people, I find, wind themselves down on purpose because they didn't feel right doing it at the same pace. One of the things I would recommend to people that do walk is to time your walks. Okay? I am obsessed with my heart rate and blood pressure and all this sort of stuff. Not because I'm a heart doctor, but because I have a very significant history in my family of heart disease. If you know my grandfather openly spoke about multiple bypass surgeries. Openly. My own father has had bypass surgery. If I think, in the absence of risk factors, that I'm not going to be afflicted with heart disease at some point because I somehow managed to escape the genetic lottery, despite looking like my father and looking like my grandfather, then I'm crazy. This thing that I wear on my arm here, as my uncle calls it, what is this tawiz you're wearing? This is a heart rate monitor. This is a monitor that checks my skin temperature, my heart rate, my blood pressure, just so that I know where I'm at. And when things are off, I know that they're off. I'm not suggesting everybody put one of these on. I do not advertise for this brand. But I think that it's important that A, everybody does something every day. Whether you walk or you exercise or whatever. Okay? I think that exercises or movement every day is a valuable way to stay young, to stay healthy, and to then also be aware that you may have something going on if something changes. The other thing related to fatigue is, like I said, changes in activity patterns. If you find yourself sleeping more, okay? If you find yourself not sleeping well, sleeping unrested, again, in the absence of any significant changes in your life. You know, it's one thing to not sleep well if you're worried about how you're going to pay the bills. It's one thing to not sleep well if you're worried about a family member who's unwell. It's one thing to not sleep well if you are unwell. But if you find yourself waking up just unrested and then needing to sleep more, again, these may be signs that you want to go and talk to your doctor about something. You know, I don't feel right. People say this all the time. You know, I just didn't feel right. I thought it was nothing. I just didn't feel right. I thought it was nothing. The next time that they feel something, they end up talking to me and they think, how did it go so bad? So, I think I've scared enough. I've scared everybody enough. I want to take questions. I want to answer your thoughts. So, please ask things, and I'm happy to open up. I've scared everybody. That's what I've done. I'm sorry. I'm sorry. That was not my intention. That was not my intention. Nobody? I said, ask any question you like. Yes. Yeah, so that's a great question. So, heart disease, okay, or coronary artery disease, two times, and then angioplasty afterwards. So, coronary artery disease, which is what the uncle is talking about, is essentially a development of blockage in the heart arteries, okay? So, if you imagine the roads of Mombasa, which are mostly awful, okay? There are parts of it that are smooth, and there are parts of it that there are awful potholes. Yeah? And we know that the potholes automatically slow down traffic because people are avoiding them, people are slowing down around them. That just makes sense. If you stay long enough without any maintenance to these roads, will they have more or fewer potholes? More. Okay? Your heart arteries are a function or are a outcome of your risk factors. Your risk factors are high blood pressure, high cholesterol, smoking, diabetes, your genetics, and how you make blockages and such. Bypass surgery and stenting are fixes that are temporary. So, back to my road analogy, a bypass is the building of a new road to get you from your house to the club because the road over here is Kabisa Bofu. Okay? Now, if we apply the same level of care that's applied to these roads to the new road, what is the likelihood that the new road stays free of potholes? Understand? So, when people have had angioplasty or bypass surgery, the goal is to preserve those things as aggressively as possible, which means you leave with a handful of medications, you stay on a handful of medications. You don't just say, I'm good now. It is a lifelong issue that if you do not take care of the risks, that the potholes will reappear. And they will reappear in the new roads, as well as in the existing roads. Ji. Yes, so that's called a silent heart attack. So a heart attack is when there is no flow at all. An artery gets cut off completely. Okay? Now heart attacks happen kind of one of two ways. They happen all of a sudden, or they happen slowly. Now let me explain the difference. All of a sudden is like two cars getting into an accident and completely cutting the road off. Okay? It takes time. Somebody has to clear the cars off. You know, ambulances are there, police are there. There's a whole shenanigans that's happening around an accident. Okay? No traffic is getting around. The road is completely blocked. That's an emergency heart attack. When people die from heart attacks, those are the heart attacks that they die from. The second type of a heart attack is the sort of a silent heart attack. Now the silent heart attacks happen in a few types of people. I'm going to tell you what a silent heart attack is, and I'll tell you what kind of people they happen in. So, a silent heart attack is a heart attack that happens when the road gets blocked, but nobody noticed it got blocked. The damage still happened, you still can't use the road, but nobody was aware that it happened. All of a sudden you showed up one day and the road is no longer working. Imagine that road in Nyali where lake. in the middle, and people are driving around and all this thing. I've driven on that road just recently. It's terrible. Okay, that's sort of a silent heart attack. You know, the rain comes and all of a sudden that road is blocked, and you think, oh, what happened to the road? Now, silent heart attacks are actually far more common than overt heart attacks. Silent heart attacks happen in people with diabetes, number one, in women more commonly than men, in older men more commonly than younger men, okay, and in people who have had recurrent sort of anginal pain, so chest pains and such. So you have the chest pains, you've ignored them, they've gone away, you've ignored them, they've gone away, and then all of a sudden the artery's closed and you no longer have the anginal pain, and so you've had a heart attack, you've had some damage potentially to your heart, but you didn't really feel it when it happened. So sometimes that's spotted on an ECG, okay, or an EKG, which is just the cardiogram. Sometimes it's spotted on an echo, which is an ultrasound of the heart, where your heart function is no longer good, as was described. Sometimes it's spotted on an angiogram, where we're looking at the blood vessels and the blood vessels are no longer open. So there are multiple ways to spot it, but silent heart attacks are much more common. One of the things that I want to talk about is valvular heart disease. So the development of your valves not working. So the heart has 4 major valves. 2 on the left side, 2 on the right side. The 2 on the left side are the mitral valve, which separates the upper and the lower chamber on the left side, and the aortic valve, which separates the heart from the body. Now the function of a valve is to open, to let the blood out, and then close and prevent the blood from coming back in. Now, as we age, the aortic valve is susceptible to becoming more hardened, calcified, and then not opening well. And again, one of the earliest findings of a heart valve that's not working well is tiredness, it's fatigue. This is why I picked fatigue as a sign. These problems can be fixed. You do not have to accept them as a situation that is, you know, irreversible. They are irreversible. They won't get better on their own. There's no medication that can make a valve better, but valves can be fixed. The prevalence or the starting of aortic stenosis happens in your 60s, it increases in your 70s, it increases in your 80s, and God give you a long life, it increases in your 90s. So 1 to 2% of people in their 60s have it, 1 to 5% in their 70s have it, 10 to 15% in their 80s have it, and more than 20% have it in their 90s. So the longer we live, the more likely we are to have a problem with our heart valve. The valve doesn't open well, we change our exercise habits, we sleep more, we feel tired, we feel short of breath doing the same things that we were doing before. If you never feel short of breath, walking, maybe you don't walk enough. If all of a sudden you take a flight of stairs and you feel at the top of the stairs, that might be a suggestion that there's something not quite right. Okay? It's not, I'm just out of shape. It's not, I'm just getting old. Question? Yes? That's a great question. So the question was about a stiffened or a hard heart. Okay? This is not, so this is the physiologic hard heart we're talking about. We're not talking about the hard heart of the Quran. Okay, right? Correct? Right. Okay. So a stiff heart is often a result of long-standing, untreated high blood pressure. Okay? So a stiff heart is the general term. The medical term for it is heart failure with preserved ejection fraction, which means your pumping function is normal, but the relaxation function of your heart is abnormal. So imagine the heart has to relax to fill and then squeeze to let out. Now, the squeezing function is preserved. It works just fine. But the relaxation function is not good because the heart is dealing with a body whose blood pressure is constantly high. Okay? And when I say high, I mean more than 140 on the top number and 90 on the bottom number. So systolic, diastolic, anything more than 140 on 90 is a risk factor for a long period of time, is a risk factor for developing a stiff heart. Okay? We have 17 medications to treat a heart that won't pump well. We don't have very many for a heart that won't relax well. Sadly, the symptoms are the same. Okay? But the treatment is to prevent the high blood pressure, okay, to avoid heart attack, stroke, hardening of the heart, and other things that happen as a result of the heart stiffening. There's a question in here somewhere. So a stroke, okay, so a stroke is just a fancy term. A heart attack, like I said, is a blockage to an artery of the heart. A stroke is a blockage to the artery of the brain. It's a brain attack. Okay? You can have any vessel in your body can be blocked all of a sudden, whether it's in the heart, in the brain, in your leg, in your organs, anytime, anywhere. And so when these things get blocked, blood flow can't get there. Okay? And so when blood flow can't get there, oxygen can't get there, oxygen can't get there, that organ, whatever that area is supplied by that vessel, can't get there, that part dies. That's a stroke or a heart attack or yes. Yes.
They say that your heart itself is so risky in your age. So now I am 80.
Yes.
15 years back.
Yes.
2015, 10 years back, I was 7.
Yes.
Almost the risk of the heart is so much you cannot tell. Is it now comparable? They say I don't know about something.
Yeah, so that's a good question. So anytime somebody presents with multiple things, heart problem with blockages as well as a valve problem, you have to do a risk assessment of whether they're going to survive you taking care of one or both problems at the same time. I think in your context, if your heart muscle wasn't strong because of the blockages and your heart valves were kind of okay but kind of not okay, then the risk benefit was we fix the arteries, we keep this man alive, let him carry on. When the time comes for the valve, we'll deal with the valve.
Now, my heart whatever is almost 35 to 40%. They say so you cannot go more than that.
Okay.
I am feeling good, I can walk. And I feel in the first day is
See, there it is. Right there. You see that? You make two excuses before I even said anything.
I was making the worst excuse. I knew that I'm a heart patient and I didn't imagine.
So, okay. Let me make you all feel not bad about making excuses. Okay? I told you what I do. You know whose son I am. You know whose grandson I am. My father once said to me, I get this funny feeling just when I'm walking. I said, that's angina. He said, no, it's not. No, I don't get angina. I said, I'm telling you, this is the only thing I know. I said, if you stub your toe, I don't know what to do about that. If you break your leg, I don't know how to fix that. But this, I know. you don't know what you're talking about. Not infrequently do I say, I'm a real doctor, right? And people will say, yeah, we know. Why are you saying that? I said, because I have to defend myself to my family all the time. My family still thinks, satoras noche, right? So, I mean, everybody makes excuses. Everybody does. It's totally normal. We get it. I get it. I'm not blaming you for making excuses. I'm just telling you, look deeply inside yourself. If you're making excuses a lot for yourself, for how you're feeling, you're probably not feeling right. As for you, the number of your pumping function, 35 to 40 as an example, doesn't matter. What matters to me is how you feel. Okay? So you probably, like I said, had a heart attack that was silent, okay? And your heart muscle sustained some damage. It's now improved significantly. We have lots of medications now that are able to even, their objective is to make you feel well. I don't care about the number. I've never cared about the number. Okay? Beta blockers are great. There's a whole stack of medications that are actually really good. You should talk to your cardiologist about them. Yeah. So medications. Let's explain medications in a simple way that you can understand. Medications. Okay. So if you imagine the heart is a horse. Okay. And if you want a horse to run, okay, the jockey gives it a little, okay? It wants it to run faster, it gives it a little bit more, Some of these good medications, these modern medications, are like the jockey's whip, okay? You can take a horse that wants to kind of just, and make him run, okay? So a heart that started at 19 or 15 to 20% is now 35 to 40%. That's a heart that's running. You have to look at it from a where he was to where he is now. Okay? So, there's an old joke that how can a woman make a man a millionaire if he started a billionaire, right? It's about where you started, right? If you started at nothing and she makes you a millionaire, that's a good woman. If you started a billionaire and she makes you a millionaire, it's the same number, but she's taking you for what you're worth, right? So he started at 19 or 15 to 20. He's now at 35 to 40. That's fantastic, right? And he feels well. That's fantastic. Okay, that's surgery and medication and doing all the right things. That's great. That doesn't matter that it's 35 to 40. There's lots of them. There's no value in discussing them unless I know your full medical history. So I would speak to your cardiologist, have an updated echo, okay, and then see what medications you're on and make adjustments accordingly. Say it again. Swelling legs. Oh, yes. So, swelling legs or edema, okay, can be a cause, can be a sign of heart disease, a heart failure, number one. It can also be a sign of varicose veins, okay, which are bubbly veins in the legs, okay. That happens from chronic standing. It can also be a sign of deeper veins that are not working well, okay? But in any case, if you have legs that are swelling and where to the point where you can press, okay, for 5 seconds over the bone and leave a fingerprint, you should get checked out. Sometimes swelling legs are just because you came from 10 degrees and you came to 35 degrees. Sometimes you're just dilated because of temperature changes that are very dramatic, okay? Sometimes it's because you're not moving enough, okay? And so what's happening is that your legs are, but if you're noticing that your legs are starting to swell and the swelling doesn't go away with movement or with elevation, you should get checked out. Say again? Exactly. So on a long flight, when you're in the seated position, okay, and not moving, you may notice that at the end of an 8-hour flight, for example, that your legs are swollen. The reason that they tell you to move around on flights and do those like calf exercises and such is to make the muscles contract to push the blood back up. Okay? Otherwise, gravity will keep the blood down in your legs get swollen. Okay? The blood gets trapped in your legs, the legs get swollen, the blood then has a chance to clot, and that's where deep vein thrombosis comes from. So anytime you're on a flight, you know, you should stand up and move. Yes. Yes.
What could be the cause environmental?
Of prostate problems?
What could be the cause?
The cause is simple. Yeah. So the cause is simple. The cause is getting older. It is. I worked with a pathologist, and we did a project when I was in high school. And he said, if every man lived to 100, every single one of us would have a prostate problem. The prostate is, is a gland that is responsible for seminal function, for making semen. Okay. As we get older, we no longer need it. Okay, and it just grows, and it most of the time it grows and it becomes useless, and then that's the cause. So the treatments are many. There are medications, there are surgeries. Most prostate issues are completely benign. And even nowadays, even if you, God forbid, get prostate cancer, again, most men will die with their prostate cancer rather than of their prostate cancer. So even prostate cancer is very manageable.
Give us some good news.
Give us some
How
good
do you
news.
make the heart grow younger?
Exercise. So okay, now let's go back to my fancy tawis over here, okay? Your age, okay, is a number, okay? And so we have this saying, age is just a number. As I told you, I've operated on 98-year-olds and less. The best patient I did in recent memory was 88. I did heart surgery on an 88-year-old. Okay? That man came, he had bypass surgery, he was gone in 4 days. Home in 4 days. Okay? This man was full of vitality. Okay? He was strong, he had an active life, okay? He still had all his marbles, okay? He was still actively engaged in a lot of activities, okay? And he was youthful, okay? Now, how do we get that? Well, you look at the things that this guy does. He doesn't work per se, but he still maintains an active interest in the things that he used to do. He has a very busy social schedule. He and his wife travel frequently. He has, his investments that he manages. He's mentally and physically engaged. When he exercises 3 to 4 times a week, and again, the exercise that you're imagining is not to get muscles that are like this, where you can't put your arms down like you were trying to do when you were 20, right? But even 5-pound weights, 5-kilo weights, okay? Doing them regularly, resistance exercise, is a way to maintain muscle strength, okay? And movement and vitality, right? All of these things are like money in your physiologic bank, okay? So one of the things that we talk about when I operate on people is reserve, okay? So let me give you an example. If you go to work and you save money every month, all right? You pay your bills, but you manage to save money every month so that your bank balance continues to grow, all right? If some emergency happens, Okay? You get a flat tire, you get an engine trouble with your car. What do? You take the car, you get the car fixed, you move on with your life. Okay? If you live paycheck to paycheck, you never save money every month, you are stressed constantly about money, and some emergency happens, okay? Where your car breaks down or something like this. What happens? You're taking the bus, okay? Because you can't afford to fix that car. You're walking to work. You're doing something. If you then are late to work because you missed the bus one day, and you get fired, now the little money that you had coming in, you don't even have that. Next thing you know, you're on the street. If you look back on the whole situation, you think that it started from a flat tire, a busted engine. But it started from the fact that you lived so tight and had no reserve. Physiologically, the same thing. If a major medical problem happens to you, okay, and you are just teetering on the edge, okay, because you don't really work, you don't really move, you don't really exercise, you don't really eat well, you don't really worry about these things, I'll be fine, it'll be fine. And then some physiologic, major traumatic thing happens to you. You have to have major surgery, you have a heart attack, you have something happens. Okay? Your ability to recover from that, okay, is much worse than somebody who works out regularly, eats very well, you know, looks strong, looks, the phrase we use is looks younger than their stated age. Okay? If somebody tells you that, you know, I'm 70 years old, and you go, wow, really? Versus somebody tells you, you know, I'm 60 years old, and you go, oh, really? Okay? You know what I'm talking about. Right? This is not some magic thing. So the way to go, I'm 70 years old, and go, wow, really good. You know? That's what you want. That person has physiologic reserve. Okay? They do things to put money in their physiologic bank. Okay? Therefore, if they were to have something major happen to them, okay, then they have reserve to pay. Because major surgery, a heart attack, costs something. Okay? When we talk about going home to recover, all right, from a major episode of some kind, what is recovery? What is recovery? Recovery is just what? It's nothing. There's no bandages to be changed. There's no, you take the same medication. What is recovery? Recovery is the time for your body to put itself back together. But if it has no resources to put itself back together, then what are you going to do? What does recovery look like? So, good news. Good news is that wherever you are today, you can be better tomorrow. Okay? You can walk. And the only person you need to compete against yourself, the only person you need to compete against is your yesterday's self. So today, it takes me 10 minutes to walk around that thing. Call it even 15 minutes. Tomorrow, it took me 14 minutes and 50 seconds. That's a win. That's a win. That is putting money in your physiologic bank. 3 months from now, it takes me 11 minutes to walk around this. That's a win. You are putting money in your physiologic bank. So, the moral of the story is, don't ignore fatigue. Stop making excuses for your symptoms. If something's really wrong, go get it checked out, because it's better to get it checked out and be told that it's nothing than to find out that there's something devastating. And wherever you are today, you can be better tomorrow. Thank you very much.
Ahsan, Dr. Iqbal, for sharing all your views with us. But you haven't given us the shortcut to become young. There is no such thing. Okay, you have to work hard for it. Alhamdulillah. ટાઈમ ઓછો છે, ચાલો પહેલાં આપણે આપણા મરહુમીનને યાદ કરીને એક સૂરે ફાતિહા કરીએ. ફાતિહા. સાથે મળીને દુઆ કરીએ. પરવરદિગાર હઝરત હુજ્જત અને અહલુલ બૈત અલૈહિસ્સલામના વાસ્તા લઈને તારી પાસે માંગીએ છીએ. પરવરદિગાર અમારા ગુનાહોને તું બક્ષી આપ, અમારા અમવાતોને તું બક્ષી આપ. મોમિનીન જેઓ બીમારીની અંદર છે તેઓને જલ્દ અજ જલ્દ શિફાએ આજીલ નસીહતે કામિલ અતા ફરમાવો. મોમિનીન જેઓ મુસીબતોની અંદર ફસાયેલા છે તેઓની મુસીબતોને તું દૂર કર. પરવરદિગાર આ મગરિબનો વખત હવે બાજુમાં છે, જુમાનો દિવસ છે, જે દિવસે તું તમારી હાજતો કબૂલ કરે છે, સર્વેની હાજતોને તું પૂરી કર. હઝરત હુજ્જત કાયમ આલે મુહમ્મદ જલ્દ અજ જલ્દ ઝુહૂર ફરમાવો અને અમોને એમના અંસારમાં મુકર્રર કર. બિહક્કી મુહમ્મદ વ આલે મુહમ્મદ સલવાત. અલ્લાહુમ્મા